Paramedics may find that laryngectomy patients have 4 different types of voice. The most common type of voice in the UK is for a patient to have a voice prosthesis or a speaking valve.
I am speaking with a valve, sometimes called a voice prosthesis.
This is a small silicone valve that fits at the back of the stoma, and it connects the trachea with the esophagus in what's known as a trache-oesophageal fistula. When the patient wants to speak, they put their thumb or their finger up to their stoma and block it with their thumb. The air then passes through the valve and into the esophagus. As the air passes through the esophagus and up through the mouth, they vibrate what is known as their laryngo-esophageal segment to make voice.
I am speaking with a valve.
The second type of speech the paramedics may find is the patient has esophageal voice.
Esophageal voice.
The patient learns to push air from their mouth down into their esophagus and back up again, quite similar to a belching sound, to produce voice.
When I attained esophageal voice, which I'm using now, it was one of the most satisfying moments in my life.
As the air passes up, it vibrates this laryngo-esophageal segment to make a voice. This voice is not as loud or as fluent as a valve voice. The third type of voice the paramedics may encounter is a electronic larynx, sometimes called a Servox. That's a brand name, the most commonly used in the UK.
My method of communication is by using the artificial larynx.
To speak with this, the patient will have a small mechanical vibrating device they put against the side of their neck.
This is my voice.
This gives an electronic sounding voice as the electronic tone passes from the device through the tissues and into the mouth, where they shape it into speech.
My method of communication is by the use of the artificial larynx. This one has a trade name of the Servox.
The fourth type of speech they may find is a patient is just silently articulating. I would imagine this is the most common type of speech they may find if somebody is in a very difficult, distressing medical emergency, because the patient may no longer be able to produce their valve speech or their esophageal voice, or they may not be able to find their electronic device very readily. So that's something that they may need to watch out for. They should watch the patient's lips very carefully. They may want to ask the patient to write something down with a pen and paper. That might be a good idea as well.